getting an endometriosis diagnosis and the obstacle of medical gaslighting. So, endo is often not picked up on ultrasound or MRI. Typically speaking, if endometriosis isn't detected, I rarely hear from women showing that there was further investigation. And then women are typically refused surgery because they're scared off with post-operative scar tissue and with possible risks to their fertility. So MRI seems to be the best non-invasive diagnostic tool for endo. I know that you used it with me as your patient. What are its capabilities and what are the limitations?
Okay, that's a very good set of questions. There is a very big difference and variations on the quality of MRI scans and ultrasound scans, because some of the ultrasound scans can totally be spot on and as good as MRI. It's all operator dependent. It's all depending on skills of the operator. And some MRI scans can be very basic. As soon as the radiologist sees no cancer, they sort of lose interest. We've seen that as well. So it's all about who is doing what and which center of expertise is dealing with it. If the symptoms are there, textbook symptoms, right? Severe menstrual pain, severe pain during intercourse, severe bowel symptoms during periods, that's textbook. Even if ultrasound scan is negative, even if the MRI is negative, you still don't ignore the symptoms, because we know that superficial endometriosis can cause a lot of pain and it's not seen on the MRI. So that a negative MRI does not rule out endometriosis. So you need to do a laparoscopy. In the symptomatic patients with negative imaging, laparoscopy most of the time will reveal endometriosis. That's how endometriosis is diagnosed. We need a very detailed history. We need a very meticulous gynecological examination. We need advanced imaging, endometriosis grade MRI scan, endometriosis protocol MRI scan. And depending on the MRI, we either progress to look and see laparoscopy, plus minus excision of endometriosis if it's found, or if MRI is positive, we do it for the mapping of the disease, so we know exactly where endometriosis is, and then we can make a plan of treatment, either with gynecology endometriosis specialist alone, or as a multidisciplinary operation, and that's something endometriosis centers do. We should, if we say, no, you don't have endometriosis, if the patient is symptomatic, that should be really, really proven by the advanced methods. There is a clear pathway how you tell the patient, yes, you do have endometriosis, no, you don't have endometriosis. And that's history taking, examination, imaging, and I put MRI and ultrasound, specialist ultrasound, more or less in the same category, and then inspection of the abdomen in a very particular way, which endometriosis center recommend.